Every parent dreams of holding a healthy baby in their arms. They imagine first smiles, first words, the first day of school, graduation, marriage, and a bright future. But for some families, those dreams change forever the day they hear the words, "Your child has a genetic disease." In that single moment, happiness is replaced by fear. Questions begin to race through their minds. Will my child survive? Will my child ever walk? Will my child ever speak? Did we do something wrong? From that day onward, life is never the same. Instead of planning birthdays and vacations, parents begin planning hospital visits, doctors, specialists, blood tests, scans, physiotherapy, surgeries. Hospital corridors become a part of everyday life. Watching your own child suffer is a pain that words can never fully describe. Every injection, every medical procedure, every cry of pain feels like a wound in the parents' own hearts. If they could take their child's pain upon themselves, they would do it without a second thought. Then comes the financial burden. Medicines become monthly expenses. Medical equipment must be purchased. Therapy sessions continue for years. Many families spend their life savings trying to give their child the best possible care. Some sell their valuables. Some take loans. Some are forced to leave their jobs because caring for their child becomes a full-time responsibility. The emotional burden is just as heavy. Sleepless nights become normal. Parents stay awake wondering whether their child is breathing comfortably, whether another emergency will happen, whether tomorrow will bring good news, or another setback. Exhaustion becomes part of everyday life. The entire family is affected. Brothers and sisters quietly sacrifice their own wishes because they know their sibling needs more attention. Family outings are canceled. Celebrations are postponed. Life slowly begins to revolve around hospitals and treatments. Many parents silently carry another burden: guilt. They ask themselves questions that have no easy answers. Could we have prevented this? Was this somehow our fault? Even when the answer is no, the feeling of guilt can remain. Sadly, some families also face misunderstanding. Instead of compassion, they hear hurtful comments. Some blame them. Some spread myths. Some avoid them altogether. This isolation can make an already difficult journey even harder. The stress also affects relationships, financial pressure, emotional pain, constant worry. For some couples, these challenges strengthen their bond. For others, the weight becomes overwhelming. And perhaps the deepest fear of all is the future. Every parent asks the same heartbreaking question: what will happen to my child when I am no longer here? There is no easy answer. Yet every day, these parents continue. They keep fighting. They keep hoping. They celebrate every small achievement that others might overlook: a smile, a step, a new word, or simply a good day. Their courage is extraordinary. No family chooses this journey. Behind every child living with a genetic disease is a family carrying invisible burdens: emotional, physical, and financial. Understanding these challenges is not about creating fear. It is about helping us understand the reality that thousands of families live every single day. It is about encouraging compassion instead of judgment, offering support instead of isolation, replacing myths with knowledge, and promoting informed decisions through education, genetic counseling, and appropriate genetic testing whenever it is recommended. Every child deserves love. Every family deserves understanding. And every informed decision has the potential to reduce suffering for future generations. Because awareness is not about fear. Awareness is about hope. Hope that fewer families will have to face this painful journey, and hope that those who already do will never have to face it alone.